Hello and welcome to the seventh and the final episode of our podcast series for the community's Grand Cyclate under 8 minutes. I am your host Chinmay Kumar from Asia Pacific Regional Learning Hub. Over this series, we have unpacked the technical, human rights, and gender elements of Grand Cyclate. Today, we are closing with the structural framework that dictates whether any of these programs survive long term. It is known as Sustainability, Transition, and Co-financing, also known as STC. As we face changing financial landscapes, understanding health finance is no longer just the accountant's work. It is essential toolkit for community survival as well. To help navigate these high-level mechanisms, I am honored to be joined today by a very special guest, Matthew Macgregor, head of the Health Finance Department at the Global Fund. Matthew, very warm welcome to the podcast.
Wonderful to be here.
Thank you so much. Let's dive straight into our three critical questions. Matthew, when we look at this bigger picture of health financing, what do we actually mean by transition pathways in the context of Grand Cycle 8? Over to you.
Great, thanks, Shinmi. So supporting countries to prepare for transition away from external financing has always been a really big part of the Global Fund's work. But as you said, it's taken on much more prominence in this current grant cycle. And that has a lot to do with the changes we're seeing, the changes in the funding landscape, the push for countries to have more self-reliance on their own funding. And we need to be working on this to sustain the massive progress that we've made, working closely with countries, partners, and communities. A big piece of this, Chinmi, is defining clear, predictable, and transparent transition timelines. This is something we're doing in GC8 more robustly than ever before. And the idea behind this is really to enable countries to plan in advance for transition, to avoid abrupt transitions, to increase the predictability and the transparency about our financing, and then use those timelines to properly shape the investments that the Global Fund is making with countries, the co-financing commitments, and to make sure that the entire focus at the country level is really around implementing effective transitions as much as we can. It's not just about timelines. We want to be working with all countries on preparing for a transition, and it's a very key piece of our work. So when you think about this concept, we use the term transition time pathways a lot. And stepping back, what do we mean by that? And what I would say is it's really about taking a careful, thoughtful, and intentional effort to define what transition challenges exist, and then what actions we can take to address those challenges. It's going to differ based heavily on country context, but I think there's a few common themes that we can talk about. And those would be, is there a well-governed transition planning process? And is it inclusive of all country stakeholders? What we really want to see is a national conversation around addressing these transition challenges. So that would be a first piece. A second big piece of this is around transitioning specific costs. We know that there's a lot of support from Global Fund grants for really critical elements of the national responses, and we need to be working with countries to transition those costs over time. A third piece of this is supporting reforms at the country level. There's a lot of changes happening at the country level. There's reforms to service delivery. There is reforms to how we finance the health system. And as we think about transition pathways, we have to be thinking about how our grants interact and support those. And then a few more I'd mention is that we've got to clearly be thinking about the financing of community systems, including via social contracting, which we're going to talk about. Community systems are so central to some of the national responses that this has to be front and center. And then I think the last one I would say is we've got to really be thinking about how we can have very cost-effective health product procurement. We know that the Global Fund plays a big role in health product procurement. We know it's critical. And as we think about transition pathways, making sure that we transition those types of costs are going to be critical. There's many more than this, and it will depend on country contexts. But how well we make sure funding requests, grant design, co-financing commitments support those pathways is really critical.
Thank you so much, Matthew. I guess that gives us a very vital structural view of what sustainable pathways look like. But you also mentioned cost many times, and but a transition pathways cannot function without a solid financial commitment from national governments. So moving to our second question, Matthew, what are the specific requirements for domestic resource mobilization and co-financing that communities need to watch out for in this cycle?
Thanks so much. So I'd answer this question by stepping back and reminding us that global fund financing complements country funding for HIV, TB, malaria, and health systems. We're a catalyst. We're designed to support improvements, but ultimately without displacing the central role that countries themselves play in financing and managing the national responses. And this is why we put such a strong emphasis on improving domestic financing in our funding requests, how we make our grants, and how we work with countries overall to improve the financing of those responses. It's not an easy time to do this. Countries are facing a lot of financing challenges, a lot of competing priorities, and it's one of the reasons it's becoming even more central to our work. You talked about our requirements. There are many ways in which we support domestic resource mobilization, but I want to focus on one of the most visible aspects, which is our co-financing requirements. Um, as I think you know and many know, the Global Fund uses our grants to encourage and work with countries to invest their own resources. And a percentage of our grants are conditioned on countries making sufficient commitments to finance their national responses and then realizing those commitments during the grant cycle. And we do this for a couple of reasons. We want to promote ownership, accountability in country financing, and we also really want to have a balance between what the Global Fund is financing and what countries are financing through their national investments. We take a holistic approach to this. It doesn't look the same in all countries. We have a very differentiated approach, but there's a few common elements. So first, we have three requirements. In low-income countries, in lower middle-income countries, we ask countries to make overall increases in health expenditure. And that's because we want to see stronger health system financing as a basis for strong financing of HIV, TB, and malaria responses. The second requirement we have is financing of specific programmatic interventions. We want to see over time countries increase their financing of those specific programmatic interventions that have often been financed externally. And this is fundamental to thinking about transition. And then third, we have requirements for disease-specific co-financing. While we know that health system financing overall is critical, we do want to keep a focus on making sure there are sufficient resources for HIV, TB, and malaria responses or critical RSSH priorities. We've learned a lot about co-financing, and I could spend 2 podcasts talking about it, but a few very quick lessons learned. The first is that co-financing can't be an afterthought. We have to make this a central part of early discussions of how we design our grants. The second is we've got to align co-financing commitments with those grants. We want to see a strong linkage between what's being financed in grants and what's being financed domestically. The third is really focusing on ownership and accountability, making sure that we're having honest, realistic discussions with countries about what they can finance, and then working through the grant cycle with countries to make sure that they're investing those resources the way that they've committed to doing so. And then finally, making sure we align these commitments with fiscal capacity. We have a lot of different countries, and they're facing a lot of different challenges. We want to make sure that co-financing is both ambitious, but also aligned with the fiscal context that countries are facing, and making sure that we do this gradually over different grant cycles. Co-financing is just one piece of a bigger puzzle. We do a lot of work on domestic resource mobilization with innovative financing, with advocacy, but it's a very key part of grant cycle 8, and we've got to do it very, very well.
Thank you so much, Matthew. I guess you like very rightly mentioned about ownership. You also mentioned it has to be central part of our work. Like securing domestic budget allocation at the national level is a huge win, definitely. But that money should actually go towards organizations, towards communities, right? So my final question to you is, what practical steps can communities take right now to advance social contracting and ensure public funds are successfully channeled to community-led responses at the country level? Over to you.
Yeah, It's such an important question, Chinmi. So first, I mean, I think we should start with something that you've probably heard on this podcast before, which is that communities play a critical and fundamental role in the delivery of health services, and how they are financed adequately, and if they have those resources to provide those services, is critical to reducing morbidity and mortality, and ultimately the sustainability and effectiveness of national responses. There is such strong evidence that strong community financing leads to good health outcomes. And that's what we're talking about here. And because the Global Fund and other external financiers have provided a strong amount of financing for communities in the past, the way in which we work to push public financing, or what's called social contracting, of community service delivery is really, really, really critical. You know, the concept of social contracting really has two elements. The government agrees to pay with domestic resources a community or a civil society organization for a service, and a CSO or a community provides that service. And I think as we think about what communities need to do and what challenges we face, we need to think about both of those elements. There's a few critical things, in my view, that make this work. So the first is political support, ownership, and really willingness to compromise on all sides. Building strong social contracting really requires strong relationships and institutionalized relationships between governments and between communities. So starting early and building those relationships is critical. It also requires strong legal and policy frameworks. So for example, we know that public procurement processes can be rigid. They might be too demanding for communities or civil society. And they might make it hard for less formal organizations to contract. We know that there are issues around accreditation. We know that, or licensing. We know that there are issues around M&E requirements and tendering. So making sure that we work on those types of technical aspects is really critical to seeing the delivery of that financing. So this is where I would come to your specific questions. What can communities do? And I would say three things. So first, I think communities need to work to push for sufficient financing of these services. Being at the table and talking about the value added that they bring to health services is really critical. And that links to what we were talking about previously with co-financing. We do want to see more co-financing commitments, specifically focused where it makes sense on community service delivery. The second thing I would say is I think communities need to prepare to change and evolve a little bit as we rely less on donor funding and more on domestic financing. So for example, communities need to be thinking about, do they understand the public procurement rules at the country level? Can they tender? Can they bid for services? What are they ready organizationally in order to do that? Are they registered? Are they accredited in order to be able to provide those services? As we rely more on domestic financing, we'll need to see how communities evolve. And the last two things I would say is that communities also need to play a strong role in defining the packages of services that are ultimately provided. Communities have really significant knowledge about which services should be provided, how they should be provided. And as we're defining these arrangements, having communities at the table discussing those with governments is quite critical. So as I finish, I'll just simply say, social contracting is really critical. We do have to remember it's one piece of the puzzle. Communities also have critical functions around accountability, advocacy, and not all of those will be included in social contracting. Social contracting shouldn't be seen as a solution to everything, but it is a very critical part of financing the national responses.
Matthew, thank you so much for your incredibly sharp insights. Any final comments from your side?
I would just thank you, Chinmi, and say, these issues are challenging. Issues around transition, issues around co-financing, issues around social contracting are not easy, but they are really critical. And we need to be working with all stakeholders, including communities, to make sure that they're central to our thinking in this grant cycle. So thanks so much, Chinmi.
Thank you so much, Matthew. Once again, you have reminded us that health finances, it isn't just about numbers. It's about the political will to protect health equity and community-led solutions for the long-term responses as well. To our listeners, this marks the final episode of Grand Cycle It Under 8 Minutes series. This entire initiative, which we call Extra Miles by 7 Alliance, has been our love and commitment from the Asia Pacific Regional Learning Hub to ensure you have the knowledge to claim your seat at the table. As we wrap up this journey, we want to hear from you. Do you have any remaining questions about today's financial topic or any of your previous 6 episodes? What critical challenges are you facing right now? And what topics should we cover in our next podcast series? Please drop your thoughts, feedback, and questions in the comment section below. Share this final video widely with your networks and make sure you are subscribed to our YouTube channel and newsletter. I'm Chinmay Kumar. Thank you for walking this extra mile with us. Let's keep moving forward together, ensuring this cycle and the future of our health systems is always built with us and for us. Thank you so much. Stay tuned.